So you have the area between the two condyles of the tibia. So we call it intercondylar area. So the intercondylar area, it has the anterior intercondylar area and posterior intercondylar area. And that is going to give you the origin of the anterior cruciate and posterior cruciate ligament. Anterior will come out of the anterior area, posterior will come out of the posterior area. This is the ACL and this is the PCL. You guys need to know how are those fibers running from the tibia to reach the femur, because we need to support. These are ligaments to attach femur to the tibia. All of the ligaments, they need to attach people on top, which is femur, to people down, which is mainly tibia, and one ligament would be to the fibula. So the ACL comes from the anterior intercondylar area and it goes to the femur, and the PCL comes from posterior intercondylar area, it goes to the femur. How do they work? I want you guys to think about the running fibers of the ACL and PCL as if a kid is trying to throw a ball. Imagine that the ball starting position for this guy who is wearing the yellow shirt is actually here. So once you get the ball from the anterior intercondylar area and you move laterally, so what is the running fibers of the ACL? It is upward, backward, laterally. Look at him again. This is lateral, it's going away from his body. So from the anterior intercondylar area, all right, so from the anterior intercondylar area, the ACL will run upward, backward, laterally. Okay, so remember, so if you are running upward, backward, laterally, it means you want to reach which femoral condyle? Of course, the lateral. So if you guys look at the this picture here, you will find that this is the tibia, all right, and this is the femur. Okay, so the ACL is going to move all the way from the anterior intercondylar area to the lateral femoral condyle. All right, so it runs all the way from the ACL to the lateral femoral condyle. Okay, which surface exactly is it? It's gonna be the medial surface, so it's the opposite. Okay, it's gonna go to lateral femoral condyle but medial surface. Okay, and it makes sense because the ACL is running in the center here, so it's gonna be, this is lateral femoral condyle, so this is medial surface. Okay, now if you think about the opposite, which is the PCL, think about a ball who is ready to throw the ball. So that was a kid that is trying to get ready to throw the ball, but he didn't throw it yet. From the starting point to all the way lateral from his body. Now he wants to, the other boy wants to throw the ball medially. So if he throws the ball, it will come from the posterior aspect. It will run upward, forward, and medially. If you guys look at this ball, it runs upward, forward, and medially. So look at the PCL. It runs upward, forward, and medially. All right, so this is tibia, this is fibula. So this is the medial femoral condyle. Which surface? It's gonna be the lateral surface. Okay, so medial femoral condyle, but lateral surface. All right. So this way you will remember the running fibers of ACL, PCL. You will remember the origin or the starting point and the insertion of the ligaments. Just I want you to think about a balloon, a ball, and that you are trying to throw until you get into the starting point. From the starting point to the ball being actually away from your body, backward. This is the ACL, and from that backward aspect you will throw it medially, and that will be the PCL. So if you want to starting point here and the anterior intercondylar area, this is ACL until you go to the lateral femoral condyle, medial surface of it. And once you are actually throwing the ball, it means you're coming from the posterior intercondylar area and you are going medially to the lateral surface of medial femoral condyle. Okay, guys, this way you will remember how does it run. Now, we talked about the ACL and PCL. as intracapsular ligaments to support the knee joint. The other two ligaments are the meniscofemoral and meniscotibial or coronary ligaments. Um, what is the meniscofemoral? The meniscofemoral is actually a ligament that wants to come from the meniscus. Can you guys see a ligament here? Forget about the PCL that comes from the posterior intercondylar area. These are the two areas here, femoral condyles. This is medial meniscus. This is lateral meniscus. Can you guys see a ligament comes from the lateral meniscus to the medial femoral condyle to make extra support? This is meniscofemoral ligament. Meniscofemoral. You also have ligaments coming from the menisci going to the peripheries all the way to attach the menisci to the tibia down. All right, so we need to attach the menisci to the femur and we need to attach them to the tibia. The ligament that tries to go to the periphery here to attach the menisci to the tibia, we call it meniscotibial or coronary ligament. So with that, guys, we have four intracapsular ligaments. We have the ACL, comes from anterior intercondylar area to the lateral femoral condyle. We have the PCL coming from the posterior intercondylar area to the medial femoral condyle, and then we have guys coming from the meniscus, one to the femur, one to the tibia. The meniscofemoral comes from the lateral meniscus to the medial femoral condyle, and you have the coronary ligament that goes all the way from the menisci all the way to the periphery to attach it to the tibia. Okay, so we are fair enough here. Everyone is attached to everyone. Okay, these are the intracapsular ligament. The last ligament, number 5, we have here is the ligament that attaches the anterior horns of the right and left. So if you have the medial meniscus and you have lateral meniscus, you have a ligament that connects the anterior horns of both together. Of course, it's not circular. You know that it has anterior horn and posterior horn for the medial and lateral meniscus. So the ligament that attaches the anterior horns together, we call it the transverse ligament of knee joint. Can you guys see this? Can you guys see this? This is the transverse ligament of knee joint. Can you guys see this transverse ligament to attach both menisci? Can you guys see this ligament that attach both menisci? We call it the transverse ligament of knee joint. Okay, so here we have 5 intracapsular ligament: the ACL, the PCL, meniscofemoral, coronary or meniscotibial, and the transverse ligament of knee between the anterior horn of both menisci. Now let's talk about the extracapsular ligament. What would be that? Extracapsular, it means you are outside the knee capsule. You are outside the synovial membrane and the fibrous connective tissues that wraps around the knee joint. What would be those ligaments? It's gonna be, you have 2 anterior ligaments, 2 posterior ligaments, 2 lateral ligaments. What are the lateral ligaments? They are very easy. We have the medial and lateral collateral ligaments. You have the lateral collateral, you have the medial collateral ligament. What is the medial? It's very easy. It's a ligament that attaches the medial bone to the femur, the medial femoral condyle. The medial bone is tibia, so it's the tibial collateral ligament. What about the lateral collateral? It's very easy. It connects the lateral bone to the lateral femoral condyle. So this is fibular collateral ligament or lateral collateral ligament. So these are extracapsular. These are the lateral ones. Okay. And all right. So what else do we have? We have posteriorly 2. They are called popliteal ligaments. One is called oblique and one is called arcuate popliteal ligament. How will we remember them? The oblique one, guys, it's coming actually from the semimembranosus tendon. So if you guys, it's coming from the semimembranosus, where do you think it will attach the femur to? It will attach the femur to the what? Remember the semimembranosus insertion? Remember when we said the hamstrings, the semimembranosus goes to the posterior aspect of the tibia. So from the posterior of the tibia to the femoral condyle. So basically this is the oblique popliteal ligament. What about the arcuate? The arcuate is, we need to be fair, the oblique was the oblique popliteal ligament was actually from semimembranosus, and it goes to the tibia. And because we know that the semimembranosus goes to the posterior tibia. Okay, great. We need another one that attaches the femur to the head of fibula. That is going to be the arcuate. Okay, so we said that we have 6 extracapsular ligament. We have medial and lateral collaterals. We have oblique and arcuate popliteal ligaments. And anteriorly, we have 2 types of ligaments. The patellar, and you guys know it, the patellar ligament that attaches the patella to the tibial tuberosity anteriorly. And you have 2 retinacular ligaments. And this retinacular, if you guys look at this ligament, it's basically, if you think about your thigh, you have vastus medialis and vastus lateralis, right? Those muscles from the quadriceps. The downward extension of the tendon of vastus medialis will do your medial retinacular ligament, and the downward extension of your vastus lateralis will do your lateral retinacular ligament. All right, so at the end of the day, those guys are going to support and connect the femur to the tibia. Okay, so remember, as a recap, we said that we have ligaments to support the knee joint. We have intracapsular ligament, ACL, PCL, meniscofemoral, tibiofemoral, or coronaries. And we said that we have extracapsular, 6 in number. We have 2 laterals, medial and lateral collateral ligaments. We have 2 anteriorly, 2 posteriorly. The 2 anteriorly are the patellar and the retinacular ligament, and the 2 posteriorly, one from the tibia, one from the fibula. These are the popliteal ligaments, one arcuate and one oblique. All right, guys? Now, we need to talk about the knee injuries. I just want you, before you think about the knee injuries, to think about each ligament is going to oppose the it's going to oppose the function of the other side. If you kind of try to stretch the ligament by doing the opposite function, you are going to injure the ligament. So the injury will cause instability in the function of that ligament. Okay, I know that this sounds kind of confusing. Let's go ahead and see the ligaments, and then we will understand what do I mean. Before we just talk about the injuries, I want to make sure you guys understand what do we mean by valgus and varus. Valgus, like we said previously in the hip joint, it means when you are moving. Valgus, it means when you are moving the bones apart from each others. This is what we call the valgus kind of rotation. Another thing I want you to know, that in the valgus, you are not only separating the medial parts of the bone away from each other, you are also laterally rotating the tibia. Remember, valgus L, we will have separation away from each other of the medial parts of your femur and tibia. You will also have lateral rotation of tibia. This is very important, guys. That will make your life very easy if you understand it this way. And the varus is the opposite. You are separating the lateral aspects of your bones, and you are medially rotating your tibia. Medially. Let me just draw it correctly. Medially rotating the tibia. Okay, just remember that.